You're watching CT Live on NBC Connecticut.
Welcome back, everybody. It's time for another edition of our Be the Expert series, brought to you by Hartford HealthCare. Today, we'll find out how the pandemic is affecting people dealing with addiction. We are almost a year into COVID in Connecticut. How has the pandemic impacted those dealing with substance abuse?
Studies have shown that these people, these higher users, are the ones that have struggled the most. So across the country, emergency room visits for people using substances, whether it's alcohol or amphetamines or opioids, have gone up. And in the state of Connecticut, that's happened as well. In addition, the number of deaths from opioid overdoses has gone up. And in Connecticut, probably somewhere around 10% for 2020. That's 10% higher than the number for 2019, which was the highest number we've ever recorded in this state.
What are the obstacles to recovery for those battling substance abuse?
Well, the opposite of addiction is connection. And so when you have programs that are designed for in-person meetings, suddenly having to physically distant or staff members have to quarantine, a lot of programs closed. And the ones that could open couldn't see as many people. So that was certainly a problem. Then there's the fears of coming into a program and contracting, the virus. Also, people's daily routines that try to keep them grounded, or connection with support systems, recovery systems in the community like AA or NA, also forced to either close or go virtual. So that's all been very, very destructive and quite a challenge.
What kind of treatments are available at the Behavioral Health Network?
Well, very, very flexible in-person and virtual treatments are available. And as I mentioned, our detox program in person is available, and we do that safely with physical distancing, as well as our residential treatment. We have other programs that are running in specific communities where we can actually go out and connect with people when we're alerted by first responders. So we have the MORE program in Meriden, and we try to work with our emergency department. So if people want to get onto treatment for opioid use disorder, it can actually start there and then transition to our outpatient programs.
How are you keeping patients engaged and supported during this time?
Well, I'm happy to say that we've been able to keep our detox program and our residential treatment program safely operating at the same volumes to pre-COVID, one of the few places in the state that's been able to do that. But also using virtual as well as in-person treatment and being very flexible with that's been helpful. But in addition, we've used a lot of recovery support specialists, people with lived experience and specialized training who could reach out. And there's an application for smartphone, a digital application called Tricycle. People can log in, they can journal or do a wellness survey, and that can alert our recovery support specialists and clinicians that someone's struggling. We can try to reach out proactively. But treatment's available now, and treatment will be available going forwards, and people do get into recovery and they live better lives.